far as I'm aware, I think everybody knows the domestic rules in this place. I don't think there's anybody from the public or press, so I won't talk about that at all. So that's item 2. Apologies for absence. Do we have any? Not from Jack Scott at all. Is anybody aware if Jack Scott is still on paternity leave or?
I know he was. I don't know the end date of it.
Right. It might be worth just checking. I don't think we've had any attendance at all there. Yeah. Right, no apologies for absence. Exclusion of public and press. I don't think we have any public or press here today, so that's fine. Any members wish to declare any interest? No? That's fine, thank you. Minutes of the previous meeting, page 10. If there is anything, please shout out. Page 9, page 10, page 11, page 12, page 13, and page 14.
Just to update the committee at number 8, unfortunately it hasn't been possible to rearrange the approach to future priority budgeting to come back to this meeting, but an email will be coming out to you all with an opportunity to input into that, and it'll be hopefully with you in the next few days.
Councillor Lee.
I just wondered if there'd been any arrangements made to meet with carers and parents or young people. Yeah.
Yes, so we're in the process of setting up a session for you with some young people. I'm hoping to use the January meeting that we've got scheduled for this committee to do that. It might mean, however, that we need to bring it forward slightly to accommodate the timings for the young people. So if everyone's happy for me to do that, I'll kind of make the arrangements and be in touch.
Just if we're bringing it forward earlier in the day, could we make sure it doesn't clash with overview and management scrutiny? Because I'm on that at the moment, so I go back to back at the moment on this.
We will, because we'll need to use the same room, so it will. But yes, I think the current meeting is scheduled for 3:30, and that kind of goes beyond the school day, and they would rather keep it within the school day. But we'll keep you informed with development on that.
No, good point from Councillor Phipps there, because I think he's had a mammoth session a bit earlier on as well, haven't you? So he doesn't want another one.
So are they going to come here, or are we going out to see them?
They would like to come here and talk to you in the town hall. Some of the providers aren't able to come, so some of the young people will send written submissions, but there are I think from 2 of the schools who are keen to actually come into the town hall and talk to you.
Councillor Dunn.
Unfortunately, earlier doesn't work. I'm absolutely solid with other board meetings, and as the exec lead, I think I should be here. So I need to have it confirmed as soon as possible, because I'll have to send my apologies to everything else, and I'll need to get cover for that. So, yeah.
We'll try and in that case, we'll try and make sure it's as late as possible within the day for the young people.
It's really important that the young person's voice is heard, but it's extremely difficult because, you know, to juggle 20 things at the same time. So, yeah. And I would like to know what kind of work has been done in this area in between the last meeting, because obviously the policy forming that you're doing, Chair, is really important, and I'd like it to feed into the work that I'm doing. So I'd like, if I could get an update, that would be really helpful. Thank you.
Yes, we'll make sure you do. Thank you. Public questions and petitions, I don't think we've got any, have we? No. Right, we're going to the main session here. This is third time lucky, hopefully, that we do get this report presented to us. And what we'll do is, once you've presented the report, Alexis, we'll wait for the questions to the end. so you get the full picture before we start asking questions. So over to yourself. Thank you.
So, firstly, I just want to say thank you for the opportunity to speak today regarding the Homecare Transformation Programme. I would just like to take this opportunity to thank all social care staff in the city, who I know are working extremely hard every day, particularly during this time as in the run up to winter. Our transformation programme forms part of our wider change programme within adult social care and a delivery upon the one-year plan which was set by Sheffield City Council earlier on this year. It's a key cornerstone because ultimately it affects a significant number of residents across Sheffield every single day. And it's an absolute cornerstone of our delivery of social care across the city. So as a context, just in terms of some key numbers, before I hand over to Joe Horban, who is the kind of key lead around home care. As a context, we arrange over 42,000 hours of home care and reablement per year. And it's one of the foundations, absolutely, of social care. And one of the key things for us is about how we enable people to live more independently in their own home and in a homely setting. And what our commitment is very much is developing a model that's based around neighbourhoods, that promotes well-being, that's based on strengths, and it gives greater scope for creativity and enable people's outcomes to be met. And enables people's voices to be absolutely core to the delivery of social care. And that for me is absolutely fundamental and key to what we do in going ahead, so that people feel that they have positive experiences of social care and they feel that's reflected within this transformation programme. And ultimately to empower our care workforce so that they feel empowered also to go and develop and support and work with people in the way that I know every care comes into social care to go and do. And at that point, what I'm going to do is hand over to Joe, who is our lead around the Home Care Transformation Programme, who's been leading this programme and put a great deal of effort into taking this forward.
Hi, sorry about that, and my apologies that I'm a little bit late and then waited in the wrong room. And thank you to Alexis for kick-starting this session. Not having heard everything that Alexis has said, I will keep my part brief, but be happy to take questions on detail from anyone. I'm really proud of the Home Care Transformation Programme. When I first came to Sheffield, it was probably one of the top priorities for me was to see this incredible profession transformed and able to deliver what it really could for the city, both in terms of a strong, resilient workforce, fantastic outcomes for people, enabled to be independent at home, and also to be part of an economic, neighbourhood economic agenda as well. So far, we are 2 years into the 4-year programme, and we have made huge progress. We will be out to procure with a new model of care, the transformed model of care, in the next 12 to 18 months. And I am genuinely excited that we will be able to secure something fundamentally different for the city and for vulnerable people and for the care workforce. We have seen huge expansion in the amount of home care delivered in the city. Alexis may have covered that. We're currently delivering about 42,000 hours, which is double what it was when I started in post. And it's even all the more reason to make sure that we are getting this right. The national pressures are well rehearsed. I think we all understand the challenges facing the care sector currently, and it only strengthens, I think, the project team's resolve. I think the other thing I'd like to say about this programme is that what's really exciting for me is that it is multidisciplinary. This is not just changing a contract for care. It is fundamentally changing the way that home care is seen as part of a whole system approach to supporting people to be independent. So that includes working really closely with primary care, working really closely with the acute hospital trusts, working with clinical commissioners, and working with the voluntary and community sector, and working with communities themselves to understand what matters to them in the delivery of care in their local areas. So I'll wrap it there, and I'm very happy to take any questions.
Thank you for that, Jo. I think most people would have read the report anyway. It's been out for such a long time now. So if there's any questions as a result of it, Councillor Oxley.
Thank you, Chair. Thank you, John. Thank you, Alexis. Obviously, I've come to this fresh, if you like, in terms of I'm not aware of the work that you've done before. In terms of the report that you're presenting, is a change model going forward that with clear timelines and deliverables towards the end of it. In your report, you obviously referenced the Health Watch report from 2019 that obviously very much kicked that off. What I would like to know is how does this model, and I get it in terms of it's not just council, it's CCG and it's providers that are all working together towards that, but how is this change programme going to match, if you like, certainly those 6 areas that Health Watch reported back of areas of concern for us?
Yeah, apologies, I haven't got the report right in front of me. Can I borrow yours, Alexis? I'm so sorry. So in terms of how we're meeting the outcomes, well, the issues, the weaknesses really highlighted in that Health Watch report. We've worked really closely with Health Watch and as part of our stakeholder group, and we have been really involved in some of their more recent work as well, with Sadaka and with a number of organisations in the city working to make sure that we provide diverse and culturally appropriate and faith-appropriate care for all of our communities. So we've worked very closely with Health Watch throughout, and I think it's fair to say that, that there is, we've taken views from Health Watch, from a lot of other providers, voice and influence organisations in the city, faith organisations, people who use care, and all of that has fed in really into our process of designing and tweaking and now moving to test out the model to see whether it genuinely in practice does address all of those challenges. And although the report seems, 2019 seems like a long time ago in many ways, all of those challenges, are still the challenges we face. And I am confident that the programme will match across to that. But what I would also say is that the approach we're taking here is very much a developmental one. We'll continue to work in strategic partnership with all of the stakeholders and all of those involved in the provision of care, whether they are procured providers in the market, working with our in-house services that provide care into people's homes, working with health professionals, etc. So this won't stop the day we go out to procure a new contract. This will really get going at an even greater pace once we get to that point, and the contract will reflect that ambition to continue to develop to ensure that the outcomes promised will deliver.
So I get it that we're on a 4-year programme to get to where we want to be. So what, in terms of what the public might cast is where are we now? What has changed now since 2019? Because we're still 2 years away. So where are we on that transformation?
Do you want me to jump in on that? So one of the things that's really important, I think, when we are looking at designing new models of care is that as we do that, it's a process of action research. And so as we've been testing and learning throughout the process, and I think we've seen some significant changes, albeit against very difficult odds in the last 18 months, nearly 2 years now. We have seen some real changes. So improving and developing new training tools and approaches, new recruitment and retention tools, which we're about to really boost with additional investment supported by NHS and government grant. We have undertaken a lot of work with our existing provider market to support them to work in a more outcomes-focused way. One of our projects is working with our localities' social work and care managers to work with them to ensure that they are able to write care plans and support plans, which then translate for the care provider. So we've been doing all of this, if you like, test and learn, action research really, over the last couple of years, and we've moved substantially, I think, towards where we want to get to. We've also, making best of difficult time during the pandemic, we also looked at alternative models for paying providers, which at the time was to ensure business continuity in crisis, but was actually, we harnessed the learning from that process of paying providers for commissioned and for delivery of outcomes during that time, and that has contributed hugely to our thinking and also stimulated a lot of providers to start to seriously consider how they would work differently under a different contractual model. So while it would be easy to sort of say, well, it's you're 2 years in and you've still got a long way to go, I think we have been developing the practice, culture, behaviour across the system throughout the process. And we actually have a number of sites which are already enacting some of these approaches. So we have our Care at Night jointly commissioned service with the Clinical Commissioning Group. That is an outcomes-based contract, very much where we want to move to. And so we are testing and learning in real time with that. We also have a test site at one of our extra care schemes to trial the model there. We are about to go out and procure the controlled implementation in a discrete geographic area of the city, which is really exciting and a long time in the making, it feels, but really exciting. And we have a number of other kind of test and learn projects. So we're kind of trying this out in real time within the system and taking the learning from that. And what works, we're not stopping, we're rolling that out. Or rather, in some ways, rolling in providers, rolling in our social workers, rolling in our customers to wanting to be part of a different way of working together.
Sorry.
Councillor Linda's Hammond. Oh. Go on, come back.
Sorry, I have many questions. Sorry, Joe. Again, the report from Health Watch, and it's unsurprising, said, our population of people who are going to need this service is only going to grow over the next few years, and it did up to 37%. So within this model, how are we factoring that in? Because essentially, we know we're getting very little additional support from government to pay for this, so our costs are only going to rise. So how are we putting in better for less effectively? Because we're going to be stretched. Oh, it's even more stretched than what we currently are.
Yeah. So come in and then bring in Joe, is one of the key things about the Homecare Transformation Programme is moving essentially from what is a time and task model to that of an outcome-based and strength-based approach. And I know one of the key things from that is about how do we enable people to live more independently. And that is how we start to deal with what you're talking about. Because the issues that you're describing there have been around for the last sort of 15 years around social care. And there's been various audit reports that's been completed which highlights this across the UK, that ultimately it's that gap between the demand for social care and the resource available to fund it. And what we're trying to do here is essentially deal with that wicked challenge. But our core to that has absolutely been about how do we improve the lives and outcomes for people. And that's what this is about, is saying, keeping that key principle of ensuring that we deliver improved outcomes for people, improved experiences, but ultimately enabling people to live well and age well in communities. And it's the technicality of this is about the approach and the type of practice that is undertaken and the shifts that we want to take. So a lot of the cultural changes that Joe was talking about is about how we are supporting that cultural shift within home care across the city as we go forward to get to that more outcome-based, strength-based model.
Sorry, Chair, last question from me until I think of another one. My former colleagues at Sheffield University Shire are providing, if you like, monitoring on the project. What does that involve? What are they delivering for us?
Yeah, we've been really keen to work with Shah to ensure that, given the scale of the ambition of what we're trying to do and the systemic change that is required to really maximise the benefits, not just for social care and for the council and for citizens, but also for the health system as well, because we believe that, you know, there are huge benefits for the whole system here of getting things right for people and proportionate for people at the right time, and that will deliver best value for the whole system. So we have worked with, we are engaging Shah to work with us through the controlled implementation project and to look at our other test projects and to really to ensure that we are effectively measuring the outcomes for people, the impact in terms of budget, and the efficacy of the processes by which we administer this new way of working. So, you know, I've been really keen that we get a strong evidence base from our early implementation, controlled implementation projects and tests, test sites, all the way through and into the first stages of the developmental contract, because it is really important that we understand what's working, and there are so many moving parts in this system that we really wanted to make sure we had that independent support and challenge really to work with us and with health colleagues to really understand what was happening systemically, not just in terms of delivery of a contract.
Thank you for that answer, Councillor Lee.
Yeah, my questions are around the relationships with and the quality of the organisations we work with. So one is the health service. Sometimes I know that's been a bit fraught in the past, if to say the least. So how are things moving on? Are they improving? Are we all cooperating and working together properly? Because we haven't. We know that's been the case. And also the providers that we work with who are delivering home care, they must be under a lot of pressure. What is the quality of their management? And we know carers that go into people's homes underpaid, undervalued. And we know that because as it says in the report, they don't last long sometimes in the system. They've got to be really dedicated to see this as a worthwhile job for them. And there's no promotion, there's not much scope for advancement, is there?
They're all really, really pertinent questions. And when we set out on this path, probably one of my biggest concerns was whether we would be able to do this genuinely in partnership with all the parts of the health system, which is a complex system. And actually, the experience of, I was amazed by how many colleagues across the Acute Trust and Primary Care and CCG bought into the thinking really early on. But actually, COVID has enabled us to build very, very different relationships, very positive relationships, and actually has really provided momentum. Those relationships are providing momentum. So there is a real, we're working with Primary Care Sheffield, some of their surgeries are working already with a care provider and running a pilot themselves to look at how GPs can work better with home care providers to make sure there's rapid, quick intervention, reducing GP visits that aren't necessary, and acting quickly to build up some support for somebody on a short-term basis. So actually, we've got really positive working relationships with health, and I think that the investment that we're looking at from health into supporting home care, in particular during this crisis, as well as the other care sectors, is indicative of that commitment, really. And I think that realisation that we are mutually dependent, and the challenges we face in social care are just as much, you know, the challenges that ultimately impact on the health system, whether that's acute or GP surgeries, whether it's pharmacies even. So we've got really solid buy-in from colleagues across the system.
Additional assurances that we're very lucky in Sheffield. We have a good partnership, and one of the key things for me is ownership from health, is because we have at the moment a very challenging time around home care pressures, which you're, I think, kind of alluding to just well, and that impacts on providers, it impacts on people who use our services, and it impacts on our delivery of care. But one of the key things that's been really, really helpful over particularly the past year is that health colleagues are recognising this is a system risk, it's not just a social care risk. And that, I think, is one of the key fundamental shifts that we've made, I think, not only through the pandemic, but through the change programme, because we are working together as one to find solutions to really what is a unique situation. That includes health colleagues granting £2.8 million worth of funding to support early adoption of national living wage, and equally supporting us with additional funding to support some of our pressures during this period of time. And I think that, to me, is, you know, there is something about money follows as well, and I think that's a really helpful investment in social care, but it also shows that they also value social care and what we do. So I do feel very privileged to work at this point in time in a partnership in which people recognise the challenges, but also want to work with us to go in and find solutions. Yeah.
Thank you for that. Do you have any follow-up question?
Yes, I'm conscious I didn't fully answer Councillor Lee's question about quality and about providers. So yes, quality is one of the main drivers, really, and has been one of the main drivers of this transformation programme throughout. I think time and task approach can only go so far, and although we have seen improvement in CQC ratings in the city, and it is difficult because we've had fewer inspections over the last couple of years for obvious reasons, we have seen improved ratings across the city. I really believe that when providers are enabled and empowered to recruit staff on improved terms and conditions, on a basis by which they have ownership to support people in line with people's needs, and as they can see each day when they arrive at someone's house to support them, I believe that we will see that will enable us to make the shift that we really want to see in quality, because the quality is all about the staff, as you say, and it's about how staff feel valued and also how empowered they feel. And we know that while there are particular challenges at the moment with the reopening of other sectors and the challenge that presents us in terms of pay and conditions, we know that one of the key things for people who care and who want to be in the caring profession, for whom it's a vocation and something they care passionately about, is that they want to be able to care well. And often people leave the sector because they feel that it is just difficult to do that on a minute-by-minute, task-by-task basis. So we very much believe that we will see, and there's evidence from where this has been done elsewhere in the country and in other countries, that by enabling providers and care workers to feel empowered to support people in line with their needs as they know them as people, we will see improved quality and much lower turnover in the sector. And I think we will also see in that structure better progression, career progression. And we're working on sector career routeways at the moment as part of the project as well.
Just ask one more. I was going to ask about training, because that's one of the biggest keys to sort of improving quality and enabling people to do their job and feel valued and feel what they do is, and having some sense of independence in how they carry out their work, because it's backed up with a set of skills. Has that improved? Are there plans for that?
So we have started to develop, well, we are currently working with training providers to develop improved dementia training, for example, and we are looking at enhanced levels of training for care staff. One of the things that we also believe will be a result of working as part of multidisciplinary teams, working much more closely with, for example, district nurses, GPs, etc., is that there will be, and physios, occupational therapists, and health workers, is that will build the skill set and the confidence and the competence of the care workforce. And, that's one of the key ambitions of this programme, is that parity of esteem, really, for the social care workforce with the health workforce. And I think that will also be really significant in supporting care workers to know who to go to and to be able to have agency, really, in supporting the people that they very often care passionately about and want to support the best they can. So I think a combination of training, but also being part of a multidisciplinary team that can provide peer support, challenge, mentoring, will also be a key part in driving up the quality. And I think our care providers in the city are really keen to work in that way. And those who are starting to work more with GPs and with colleagues in the health service are seeing that, having that feedback from their staff, that they feel better supported and more empowered. So I think that's a key part of the picture.
I think that's really important, that staff, people that are going into people's homes, they have a really good knowledge of the individual and what their needs are and what their problems are day to day, and to be able to feel that they can go to people with that confidence and be listened to. I think that's really all part of it, should be part of the system.
Thank you. Councillor Linders-Hammond.
Thank you, Chair, and thank you, Alexis and Joe, for coming today and presenting the report. I think it's the longest report we've had ever in this council. I think it's only 2 months from starts in the report or something, so that's not going too badly. I just wanted to say a little bit, maybe some questions in it at some point, but a bit about, because I think this is something I probably attempted to say last time in the silence of the last meeting, just why I suggested to the Chair that it might be a good thing to look at, not just what we've got on the paper here, but in terms of for this committee, but also the committees proper, in whatever form they come out with post-May, to look at this stuff. Because I think that there are clearly numerous priorities across adult social care, from where we are with our care homes to the capacity of our brilliant social workers and our labouring support and our internal care teams doing the right things. All of those things are, things that are worthy of attention. And I think as Chair, I know you've got, some concerns and some good ideas around everything around cultural appropriateness of care. And so what I want to say is there is no one right or wrong answer about how in the constrained time for policy making that this committee or future committees is going to have in terms of what we cover. But what I do think this programme, but let's not be constrained by the absolute walls of a programme that's in train, because ultimately it's really about policy making, not just about scrutiny. I think we've got a chance to do something quite transformational, and don't I wish we had lots more money, and we weren't, and that care and council generally were funded in the way they should, and that we were trying to do it without Jo and her fantastic team having to spend quite so much time battling the absolute day-to-day of trying to keep the show on the road. And there's a number of things coming through and have come through. Alexis mentioned some of them in terms of what we're trying to do to sort out the not particularly transformational to today and tomorrow, because that's really important, that people still, the most important thing is people still get their care. But I would just like this committee, as far as possible, and all of us as councillors, to think about not just about what kind of care services we would like, but what kind of communities we would like that care to be delivered within. And actually, there shouldn't be a hard line between a unit of care going to someone's house and actually that person's wider life in the community, and the way that we as a council, and working with our partners, enable to lead the lives they want to live. At the moment where we are, there's a lot of really good ideas and good thinking about the kind of model of care, I suppose that's the word you would use, going forward. And I think it is about some of that is trying to move away from purchasing hours and minutes, and someone going, giving, very set care, to actually trying to have care workers who I think are better trained, better paid, and rewarded and empowered overall, to go and help be a real part of that person's health and well-being. I know many of our care workers across the city are a real part of people's health and well-being, but I don't really think at the moment we can hand on heart say that they are empowered to be so. So what I really think we should be looking at, going forward, is how can we make sure that the old model, there's a lot of stuff around this in this programme, which, around technology and other things, which I think is really valuable, and any authority worth its salt ought to be looking at how we can, use technology better. But ultimately, the most transformational thing that will change is how we use people. You can have as much Alexas giving people their care as you want, but it's just not that's not the end of it. The end of it is, how can we work with people to ensure that well-trained, empowered care workers are working in a way that works for people's lives? Because I'll tell you what, if and when I need care from Sheffield Council or anywhere else, I need that care to work with my life. I don't want just, Sheffield City Council's idea of some nice care that works. That is not what we can. And actually, we should be having as many conversations about how easy it is to get to the bus stop from your house, and how are we building the homes and able to live in the homes which are accessible and allow you to live independently, as we are about delivering the actual units of care. Because and I think for the future policy making in this council, and I really believe, and I hope that as many people as possible around this table today will want to run these multiple tables, will want to be part of a committee involved in social care. I really want us to widen those boundaries and support programs like this, because they're really important. But actually, how can we make people healthier? And we always talk about healthier. We always talk about healthier, right? We're all about health, and we all want to, have people eating less salt and getting more active and more minutes. And that's all true. But ultimately, how can we use the levers of this organisation to create communities that are resilient against the effects of ill health that mean that many of these hours of care have to be delivered anyway? I mean, it's great pride that we can keep delivering, spending the amounts that are outlined in this report on delivering people their home care, but ultimately we should be aiming to use that resource to improve people's lives more fundamentally. So it's how do we link what we're doing here with that longer term transformation of where people live and how people live their lives is, I just think, that's the goal. And I think we have to start here. We couldn't bring that in a paper to you all. So this is how we start. How do we get our formal care as part of a holistic view of how the Sheffield Council will allow people to live the lives they want to live? And that's a huge challenge. I don't have all the answers, but the good news is from May, we don't need, executive members to give answers. We are all of us to give the answers. And it is that kind of challenge that we all ought to go for. But it's going to be a lot of work, and we're going to be asking a lot of the officers. And I'll tell you what, that the money is really, really constraining. So, that is a hard element. But I just want to let's all think big together, and there may be other councillors that aren't here today as well that want to be involved in that work going forward, and please all do be, because I think it needs us all when the people of Sheffield really rely on it. And the last thing I would say also in this setting is that there's a lot of political issues here, because particularly I think it is a political issue how much we pay care workers, how much, how we reward them, and the way they are valued in society. But ultimately it is one that we all hopefully can create a shared vision of and actually work towards in a genuine sense. And so I hope that's something hopeful as well as challenging. Anyway, thanks, Chair.
Thank you, Councillor Lindis Hammond. I think we've got Councillor Diamond next, and then Councillor Alston.
Thanks, Chair. Thanks for your report as well, Alexis and Joe. It's really interesting and promising. I just wanted to. I've got a few questions I might do for the time. Could you elaborate a little bit more on what positive change will look like at the end of this process for the people receiving care, or what it might look like if we achieve all the aims for the people receiving care and their families, and also for staff, what would that look like actually? That's the first question.
So I'm going to come in first and hand over to Joe. For me, positive change starts with the person and their experiences, because that's what counts. That's what people remember. Now, whether you're unpaid, whether you're a family member carer, or the person themselves, or somebody's a friend, that's what people remember by social care. So for me, one of the key measures that we are developing as part of a wider around social care is around that understanding of the percentage of people who have a positive experience of social care services, and particularly for me, home care is one of them. And just as a bit of a background, I started as a 17-year-old as a home carer myself, so I have been around as home care for a very, very long time, and and I'd also been an unpaid carer myself. And so this and I think is actually one of the fundamental key measures. Alongside that is actually how we determine the outcomes, how we could also demonstrate that we are enabling people to live more independently, so that people are living the healthier, fulfilled life that George is talking about. And we could actually measure that. And one of the key pieces of work that's alongside this is development of an outcomes framework that will give us a baseline and keep improvement measures and going ahead. So hopefully that's quite helpful.
Yeah, absolutely. I couldn't agree more. And in terms of some very practical changes that I think we could expect people to experience, I think it's end to end. So I always have in mind that when somebody has to come to us for social care, things have got to a very difficult point for that person, and it's easy to underestimate how difficult things may be for them to have come to ask for help. And so when a care provider, and as well when a social worker, care manager first talks to that person, the work starts there with that initial experience, and that's why we've made this programme start to finish, the whole process. And so that person should experience a very person-centred discussion, conversation, genuine dialogue about what matters to them, not what the matter is with them, as we say in health and care. So they should feel empowered by that conversation, where they had lost power by having to come to us at all. So that's the first thing. Then they should meet, if they, assuming that home care feels like the way forward, with Homecare and a home care provider that will come and talk to them and build on that process without asking them all the same questions, understand more about what matters to them about how the care is delivered. What times of day work better? What matters? Do they prefer to have their food in this position or that position, in this room or that room? That kind of attention to detail. And that's what they should experience. And then they should experience consistency And I don't mean the same person every time, because some people may need 4 calls or, you know, visits some days, maybe 6 other days, maybe just 1 on another day, but they will have a consistent cohort of staff who know them and know why the plan matters to that person and to that person's family, to the other carers who might live in the house, the family carers, friends, as Alexis says. So they will experience much greater consistency. And even where they might have to have somebody that they don't normally have, they may well know them as the person who comes when their normal staff can't make it. They will have good communication with their care provider. Their family will have good and appropriate conversations with the care provider. If their needs change, the care provider can flex to support those needs and only needs to come and talk to us in social care if the needs change really substantially and actually a full review of that person's support needs is required. So they should be able to problem solve with the people that have got to know them best. And the other experience, I think, is that they will have much clearer and straightforward charging where they make a contribution to the cost of their care. And that will be much more straightforward, much less complicated than it is now, and will enable them to plan better financially and for their family to perhaps, as appropriate, to support with that, and not to have to deal with an invoice that looks different every month depending on how many minutes of care they've had. These are all things that we are working on at the moment, and they are significant changes, I think. Finally, the other bit that I would expect would be different is that we will have, for those people where it's appropriate and it's what they want, they will have the opportunity to explore other means of meeting their needs. So not everybody, you know, if they have a choice of some assistive technology that will support them to avoid someone having to come in and check on them and coming in and out their house and disturbing them, whether that's the middle of the night or, you know, means they have to stay in for a carer to come round when they could have gone to church group or they could have gone out with a friend for a coffee. You know, they will be supported to look at all the possibilities, to build on the strengths they've got and the interests that they've got, rather than focus on the things they cannot do. So that would be the experience I would hope people to have.
Thank you very much. That was a really useful and promising answer. Yeah, thank you. I just wanted to ask a bit more about how the substantial funding pressures that we're facing are going to affect the plan changes. For example, are they going to be a threat to our ambition of becoming having the real living wage for staff, and also moving to paying people for contact time rather than not for contact time, sorry, for their shift work, so the full time that they've actually worked, rather than just the contact time where they don't get paid for travel and stuff, which is a really detrimental to people that work in the sector, and also to keeping people on in the sector as well. Yes.
So it's a really good question, one I've expected. So I'm glad you asked it. We have, as part of our journey in terms of developing sustainability in social care, this is a key project towards this. And we have had to think about how do we deliver improved outcomes for people alongside developing sustainability in terms of social care. And one of the things we talked about earlier on is about the model. And in some ways it's easy to take a very straightforward, just stop things approach. But all you have to do is create a deficit model, and you never actually achieve the change that you want to change and change sustainability. So what we've taken is built this programme as part of, actually just very much as George alluded to, as part of our wider change programme, so that actually that is part of our wider sustainability measures and going ahead. Because if we get the model right, we will get the sustainability right and going ahead. And so that really, for me, it comes back down to that. So that's why we've kept a focus on integrity of the programme, and kept a focus on integrity, on improving the lives and outcomes for people of the city, alongside thinking about how creatively we work differently to develop that sustainability. So hopefully that's an assurance towards you, and certainly happy to pick that up out with this meeting if that's helpful.
So just to reflect a bit more on what you've said and what George was saying as well. I think technology can really help, both in the ways that you've said as well, and as a resource to empower staff and families and carers. And I think something that could really help is looking at like VCS sectors geographically, mapping what resources are in the area, and also organising like possibly it could be like a website or an app, a platform where you can see what's available in your local area, what the different organisations were, and you can also search by the support of the type of support you need. There is some open source platforms that already exist on that, which I could send to you. But finally, just the role, or one of the council's role, could be to like coordinate between all the areas. And you've spoken really positively about more joined up working between different areas already. That's happened like as a positive impact of COVID, if you like. Finally, just one thing on the culturally appropriate care. Just had some feedback about modification of toilets on always culturally appropriate, and just to see if you were aware of that, and if you were speaking to any like Muslim community organisations about that, and how modification of toilets could be culturally appropriate. Thanks.
So again, really good questions, and I'll answer in different parts. So I'll answer the last one first of all. So in terms of culturally appropriate equipment adaptations, is our occupational therapy service is a really fantastic service, and one of the key things is, as part of their service delivery, they're committed to continuous improvement, and part of that they are looking at culture appropriate ways of delivering equipment adaptations, but also different forms of technology enabled care. And so certainly what can we do is perhaps arrange for you to have a conversation with, and particularly with our occupational therapy teams and wider teams who are very much involved in exactly what you're talking about. And so second key point in terms of the kind of technology aspect, certainly for me, is I come from a world in which technology is absolutely core to delivery of care. And there's such a fantastic platforms, whether it be online digital platforms or equipment adaptations and technology that can be used. And certainly for me, is one of the key, again, aligned programmes and key drivers around us is around the enhancement of technology-enabled care alongside the Homecare programme, but also across all aspects of adult social care. For me, it's not just about home care, it's about across the board, and it's about a systemic approach to how we promote independence, enable people to live independently. So that's part of some of the wider change that I talked about earlier on, and I can certainly pick that up out with you, particularly the platforms which we're keen to get to in the future. And so finally, is in terms of the online platform, is there's been quite a few developed over the years, and some have worked really well and some have not, and I know that because I've been involved in various ones. But one of the key things that I have asked key kind of officers to start to look at is how do we align with the local area committees. In that sense, so how all our programmes, particularly home care transformation, but we've got several transformation programmes underway just now with an adult social care as part of our wider change programme, how we're absolutely linking in and aligning to local area committees and very much that locality modelling of delivery. And it very much kind of aligns, that's actually something that George mentioned earlier on, about how do we enable people to live healthy, good lives as part of all the core that we do, and we have to use all the tools, so to speak, that's around to go and do that. So hopefully that's helpful, and we could certainly be good to pick up a conversation out with this.
Thank you for that. We have a number of people wanting to ask questions, so what I'm going to do is ask the first time questions and then come round again. Yeah.
I just realised I remembered I might have a slight answer for one of Alex's points, if that's okay. In terms of any councillors here who are in the southwest area might be particularly interested that the Age UK coordinated People Clean Well partnership in the southwest, which is a relatively new thing, have actually been doing some really interesting work when I went to one of their partnership meetings recently around doing some mapping, into asset-based community mapping, and it's a pretty interesting approach, and I wonder there might be ways to share it with the committee. Let's see what we can do there, really. I think it does need to be more comprehensive and used right, and spread from the city, but also I've been asked a question about how that interacts with things like the Sheffield directory. So I think absolutely we're in the right area talking about those things. And let me see if I can share with the committee what they're doing in the southwest of the city, because I think there's some really interesting stuff going on, and it could be a model that we can really link in with our more formal care elements. Thank you. Sorry.
Thank you for that, and thank you for waiting patiently. Councillor Alston, next.
Thank you, Chair. Thank you for the report. One of the questions I was going to ask you is partly you've answered, Councillor Lee, which was about the absolute importance of motivating, training, and crucially empowering staff, making them feel that actually the job they do, they can be responsible and take responsibility and be allowed to enact that. So I just want to say that I really, really feel that is really important, but I don't want to dwell on it too much as you've discussed it. If I may, just want to, I don't like doing anecdotes, but if I could give you a couple of scenarios and maybe you could tell me how the changes that we're proposing are going to make things better for these people. So these are based on real cases I know about. So let's take an elderly lady living alone, very frail, a little bit of dementia, occasionally confused, sometimes less so. And social care were going in there 4 times a day, but for half an hour each time for meals and drinks. Some of the times they go in, she's fast asleep, deeply asleep, they can't wake her up. So then 8 hours goes by before she gets her next drink. Sometimes she's deeply asleep, won't wake up, they worry, they call an ambulance, she then ends up spending a night in hospital. How will those carers be better able to give appropriate care to that elderly lady? And I'll tell you what happened in the end afterwards. And the second case is a case that's also known to me, where somebody suddenly becomes much more, elderly person suddenly becomes much more frail and suddenly needs a lot more help, a lot of help. At what point, how much care can we then get in? I'll tell you what was offered was the standard 4.5 hours. And how do we interact with nursing and health to make sure that that person who is suddenly unwell and unable to look after themselves is sufficiently supported to be able to stay in their own home? And if I can just make another point before you answer. Yeah, absolutely, we want people to live well for as long as possible and as healthy as possible, and that is our aim. But also, as people get to the end of their lives, we don't want them dying unhappily. We want that to be an easy end, if you see what I mean. So, yeah, if you could respond to that, thank you.
Yes, so I'll take the first case study first, and I think one of the challenges for care workers and for the person receiving care in the scenario you described is that they are currently, because of the way that we commission the care and pay for the care, and the person is charged for the care if they make a contribution towards it, means that they have to arrive at a certain time, within a certain time frame, and then they have to move on to the next call, and they are driven really by the app on their phone that says you've got to move on, you've got to go and make your next care call. And that's really stressful for the carer, and it's not a personalised approach for the person receiving the care. So I think in the new model, clearly, it has to be more person-centred. And what I expect we will be driving, and what I expect the outcome of the new way of working to be, are much more empowered, more self-managed teams who work a smaller patch and who are able to, for example, if they arrive at the property and the person is sound asleep, as you describe, can actually have a workload and are paid for a shift, which means that they can perhaps liaise with colleagues who also work on that patch and say, you know what, I think I'm going to need to pop back, in an hour. Or actually, if they can't, then maybe, they arrange that somebody else who knows that person can pop back and check on them, and that they are empowered to do that rather than driven by, now you've got to get on to the next step. And equally, that they will know that person and know, when they're more likely to wake up. And if actually it becomes evident that the time that they're currently going in is not the right time, not the best time for that person, but actually an hour later would work better, they can just make that change with that person or with that person's, you know, advocate or family or whoever. And they could make that arrangement without having to come and change everything back here at the council branch. And that is a massive shift, really. So they'll be able to respond in a more person-centred way and more empowered, and look at things like whether the eating plan needs to be different, whether the nutrition is right, whether you know, and be able to talk to other professionals about how best to support this person. In the second example of somebody who, and of course this happens, who is already frail but then perhaps has a health crisis or a fall or just becomes suddenly much more frail, then the challenges there, I think, and what we want to achieve with the new way of working is that actually that multidisciplinary team can kick in around that person. So the home care provider may say to us, a social work team, actually this person's needs have changed substantially and we need to consider whether this person is, you know, actually has a continuing healthcare need. We need to look at what we're doing for this person, and that might mean a kind of a review. It will also, though, I think in this model will mean having perhaps a team meeting with GP, district nurse, with maybe there's a voluntary sector organisation that's able to support a bit more and to come in and to support and provide informal support, maybe a whole raft of ways of supporting this person better with equipment and adaptations. So I would expect the difference would be that rather than saying you've got your slots and it's 4 hours, four calls, in a day, that actually the care provider can work with a multidisciplinary team to try and address that person's needs quickly, to respond to their needs and to continue to respond dynamically to that person's needs because they are likely to continue to change.
Thank you. I'll take the second one first, just going back. I mean, I think my point about that case is we absolutely must have built into these models the ability to respond quickly, because speaking as knowing what that scenario was, it is very distressing for family, frightening, not knowing what to do, where to go when something suddenly changes. So the ability to respond quickly to the individual and their family is really, really important, and we must be able to do that. In terms of the first case, I mean, what actually happened with that person was they went in hospital and they then went into a care home, and actually, once in the care home, were so much happier because there were people there all the time they could talk to when they were awake. And I do sometimes wonder that we overstress that stay at home is best. But what you're saying as well, I think is absolutely right. If we could have those small teams who were able to say, well, actually, I know that lady. I know she often does this. She's often asleep when we go in. What we'll do is we'll go back in a little while. To be able to do that, if that really could happen, that would be fantastic, because I think that would make a huge difference. It would have made a huge difference to that woman and her family, I know, because I know them. But I also do worry that sometimes we say home is best when sometimes home isn't always. That's the end of my saga.
Let me just respond. One of the key things in Come to Post is I actually did a listening exercise, and I listened to many stories of individuals in the same circumstances. And that's where I made an absolute commitment to not only looking at home care, but also across adult social care, because the processes that you're talking about are not just about home care, it's about the wider, about how adult social care works, and that responsivity. And in some ways, I felt it was really important to own that, and to say we need to ensure that we deliver responsive and excellent quality support and care, but based around strength-based conversations. And, you know, I think the story about the individual resulting in a care home, I've heard also that story very similar again. And for me, what's really important is a strength-based conversation, because what's really important to me is that we are able to give the right support at the right time for individuals. you know, and that's what's really important, is that the individuals will know is that we're not pushing a particular model. It's got to be absolutely right for the individual and their circumstances and them and their family, and they have the ability to have that choice and control over what's right and going ahead. And that is ultimately the suite of options that Joe's put on the table, as well as, you know, as my other teams, is that's what we're trying to take forward and change, so that ultimately, you know, what I would really like to see is in, you know, as we progress all the change programmes, is that we shift away from the anecdotes and the stories that you're hearing as members to the very much of a more positive experiences of how people have had, you know, positive experience of social care across the city, and that's what we want to see, and going ahead and absolutely have the commitment to taking that forward and speaking to members, particularly out with us, so that people's views are absolutely the heart of what we do.
Sorry, Chair, just very, very quickly. I think if we can do that, the job itself will be a much more enjoyable and pleasant one.
Thank you. Councillor Phipps next, and then Williams, and then we'll do another round and hopefully bring it to an end. Thank you.
Thank you, Chair, and thank you both for your report. I thought it was Williams, sorry.
Thanks, Chair, and thanks for your answers, Alexis and Joe, and for the report. It does sound like positive steps in the right direction on this. I just wanted also to thank Councillor Linders Hammond for raising how we improve health and wellbeing across the city. I completely agree, and that's a really big question, I think, around building resilient communities people want to live in, and how we put money and make decisions as a council towards keeping people healthy and improving their well-being. A load of things feed into that, obviously, from like housing, access to green spaces, how they get around, life conditions, working conditions if they're at work, human and social contact, and more. And I agree with one of the key concepts of this report over being kind of outcome-based and looking at it from that point of view. So just with that in mind, possibly slight tangent, I've raised in the health scrutiny before the concept of well-being economy, which countries and actually local authorities in other places work to. So basing our investments and decisions around health and well-being outcomes and measuring our success as a council based on measures of the city's health and well-being. So I've asked the health scrutiny before about wellbeing economies and whether that would be something we'd like to look into. But now this is more of a policy-based committee. I guess I'd be interested in knowing if the committee would be interested in looking into what that would look like for Sheffield a bit more, what we already do, what we can improve on, and if that's something as a committee we'd like to recommend as a policy. So that's just kind of an open question for the first one, and kind of a bit more related to the report. I was just wondering, like, thinking about the NHS health and care bill that's going through government at the moment, or Parliament at the moment, does that threaten our joined up working with the changes, or have we had that in mind? Thanks.
So we've actually had that in mind over the last year, and we have taken that as an opportunity to continue to build our relationships with health, and then particularly how we look at how we formalise some of our joint commissioning arrangements, as well as formalise our day-to-day joint working. And we've got a range of different operational and strategic arrangements, both already in place, but we're absolutely seek to build upon and going forward. So hopefully that's helpful, and if it's helpful, I could give you perhaps further information out with this meeting.
Thank you, Councillor Williams.
Yeah, apologies again, Chair. Firstly, thank you for your report, very interesting. I assume in the process you've been going through, you've been doing a lot of what ifs. If we do this, what's the outcome? I just wondered if you'd had an opportunity to look at the potential positive impacts of paying the care workers above the living wage, and what are the positive implications of doing that?
have, so one of the key commitments is in the one-year plan for Sheffield City Council was to look at how we implement the foundation living wage. And that is absolutely something that we are absolutely working on as part of the commitment within the one-year plan, because we recognise we want to empower our social care workforce and have a very practical plan towards achieving that. And, you know, and that is absolutely something that we have committed to. And I would say that George has absolutely driven that absolutely behind the scenes as well, to very much support the work that we are, to absolutely empower and support our workforce. So absolutely as part of the modelling within this is absolutely one of the key areas that we've had to consider.
And if I can just add to that, absolutely. We know that the pay is really important, but the wider terms and conditions relating to that pay are probably at least as important. So, you know, a foundation living wage that is still paid by minute of contact time, with an inflation, all of our care providers, framework care providers, we have recently in the last 12, 18 months double checked that what they pay, it covers, and they do this in different ways by different providers, but ultimately that it, for every single one, it covers travel time as well as contact time. But nonetheless, there's a big difference between foundation living wage that is paid for contact and travel, but actually which is uncertain and unpredictable. And actually, if somebody doesn't want you that day because, hey, they're having a great day, and we've done a great job, that care worker risks, you know, getting a minimum amount for that care slot and not anymore. So actually, I think you're absolutely right. Foundation living wage is really key, and we are looking at the impact of where that is paid already in the sector by some providers, and where it isn't. We know that some care workers will move provider for 10p or 5p even an hour, and we know that that is not a good use of the fee rates that we pay, and it's not a good outcome for customers. But I think it's broader and more comprehensive than just the wage. It is about the way in which they are remunerated, and the basis on which that happens, and some of those wider terms and conditions as well. So the research that we are looking at nationally, which we're working regionally with other local authorities and health authorities on, and internationally actually as well, is looking at both the foundation living wage, but also how other aspects of terms and conditions impact on morale, recruitment, retention.
Can I just come back on something? Yeah, thank you for that. Have you in your own mind got a figure of how retention will improve? So I've seen a report, it's about 32% don't see this as an ongoing career.
One of the key things is I spoke to actually a number of providers and different people across the city, and one of the key things is about career pathways. So there's an issue about pay rates, but there's also about career pathways, and one of the key things that as part of our some short-term funding that we've gained, is one of the commitments I put to that is actually how do we develop a career pathway route for all social care staff in the city. And that also links to an action that was in the one-year plan around developing a social care workforce plan, because for me what's really important is that for any staff member, no matter where you work or where you start off your career, what you should be able to do is have a clear career pathway. And you know, and so for me, you know, the retention of staff is pay is part of it, but it's also what keeps you in the job in the longer term, what keeps you, you know, continue to be able to motivate. So that's a practical action that we are currently in the process of trying to take forward, and we've got some short-term funding to support that. So, and which I think will be hopefully helpful to the whole social care sector. Key also to that is good partnerships with people like Skills for Care, you know, Department of Work and Pensions, care sector routeways, so that we can also support apprentices, and particularly, you know, young people coming into the care sector, and seeing care as a career for life, which is really important, you know. And one of the key things is you can have a young person start, you know, as a social care worker, go on to do a degree, become a social worker, a nurse, an OT. That's what we want to be able to say to people, so that people see that social care is absolutely, has got many options, and it's a career for life. So hopefully that's another, I could maybe perhaps pick this up with you out with as well, if that's helpful.
Thank you.
Thank you for that. I think we're going on to the second round of questions now. So we'll start with Councillor Lee and then Councillor Oxley after that.
Yeah, just the model you described, the model described about care, you know, having a patch and a caseload and maybe one, two, a couple of people, a couple of care workers then managing and working with those individuals in that and just being very flexible about how they deliver that care. That sounds really the way to go to me. Some years ago, I don't know if you remember, Jo, we did a strategy called City for All Ages. Don't know if you remember that one? And it was a bit related to what George was saying about, you know, we want people to take the best decisions about their health and well-being without being too heavy about it right from birth, in order that they can live a long and healthy life. But we know that unless something else happens to you, when you come to a certain age, there's a certain point where the you know, last 18 months of your life, is it 2 years, then there is a point where you need you start to need a lot of input from medics and nurses, and that is the end stage, I suppose. But the aim of City for All Ages was to look at all aspects of planning and highways and transport and adaptations and what we do in people's homes that enable them to be able to live that kind of life. And I don't know whether we can have just a look at that at some point, because we did work with it for a while. We set up a board, and then a lot of things happened, and it's probably on a shelf somewhere now. It's, you know, gathering dust. So it might be worth getting that out and having a look. And also be interested to know in what discussions we can have about how the LACs may be of help, what we can do in our areas, because certainly when you think of these issues about a certain community rather than the whole city, it becomes a bit more manageable.
So thank you very much, and really great questions. So in terms of the first point, in terms of all-age disability approaches, certainly coming in, I've been really privileged to have a look at a range of different the previous work that's been around, and certainly what we've tried to do is start to adopt that within our work, so that we think about very much transitions for young people coming in, you know, who require ongoing support, and that should be very much as seamless as possible, and they should experience a good, you know, have a positive experience and the best start. But also we've tried to embed that in some of particularly the focus that we're having within the Autism Partnership, our work around Change of Futures, which is around supporting people with multiple disadvantage in the city, and equally Andrew Wewell, who's our Head of Services and Future Options, chairs the Disabilities Partnership, and is also considering thinking about how do we also think about that all-age approach. So there is a range of options underway, and it's something that we've actually been very, very committed to, because we know if you've got that seamless approach, that ultimately improves the lives and experience of people. So, and I'm certainly going to look out the strategies that you talked about as well. So thank you for that. And in terms of the local area committees, I'm absolutely committed to the local area committee model, and I think absolutely see the opportunities around for adult social care around it. And to that end, I've had a couple of conversations with Don Shaw as to how we start to shape and how we go forward, not only in terms of this kind of programme, but also thinking about the wider adult social care as well, and how we are very much aligned, because you're absolutely right, huge amount of opportunities, and certainly for me it's an exciting opportunity for the future to think about how we are very much seen as part of communities across Sheffield and enabling people to live good lives.
Thank you, Councillor Oxley, and then Councillor Dunn.
Just following on from what Councillor Lee just said, will our model fit those young adults who need support and care, as well as those, you know, that traditional model of it's more the older generation that is needing that support because it's frailty, it's getting towards end of life and so forth. So does the model fit that cross age difference?
Just jumped in there. So yes, absolutely. And you're right, we do tend to think of home care as something that older people will access, and that's predominantly the case, but not the only use not the only group of people that will use home care. So we've mentioned all age disability, and I would just I also work and have responsibility for commissioning learning disabilities and complex physical disability sensory impairment services as well, and also looking at how we drive improvements in our direct payments approach in Sheffield, which enables people to have their own personal budget, which they can then manage with support to have control and choice over their care in a flexible way. And so there are a range of options. We also have supported living in the city, and we have day activities provision. And I would say that actually over the course of the pandemic, we have seen huge creativity from some of those other providers as well in how they support people to have their best experience of life. And that's one of the key parts of the home care programme, is making sure that what we're learning in home care, we're extrapolating that, we're thinking about how that applies in the other services that we commission and the way that we work with people in different situations. For example, we've covered tech-enabled care, for example, and tech care delivery. But there are, the outcomes-based support planning is something that actually, is probably slightly further on in some learning disabilities, physical disabilities services, just by nature of the way that is provided and the way that care is commissioned and procured and paid for. So we are kind of cross-fertilising all of that knowledge, really, so that it is so that we are able to ensure that all of the improvements and all of the steps forward we can translate across the piece, and that includes things like the foundation living wage, the way in which staff are paid across all of the sectors, not just in home care. Yeah.
And two other questions. When you're delivering any change model, you've got a degree of resistance that you've then got to overcome. So in terms of where we currently are, where has been or what has been the biggest source of resistance to the change model that you're trying to input? If you dare tell me.
It's a really good question, and yes, you're right. Any change will encounter resistance, overt or sort of innate and inherent, or unwitting. And I think because we have taken time over this, and I think because some of the changes in dynamics as a result of the pandemic, actually, a huge amount of that resistance has fallen away just because we've been in so much dialogue with so many stakeholders. And what we've tried to do is to co-produce with people who use services, with organisations who support people who use services, with our social work teams, with our care providers. So there's been a lot of discussion and generative dialogue, if you like, all the way through. And I think that has actually gone a long way to tackling resistance, because people have had to listen to each other and take stock. And the pandemic has promoted a different way of working together. That said, there are challenges. This is a massive shift in working, and we're under no illusions about the scale of the challenge. And, what they say, culture eats strategy for breakfast. So we know if we don't get the culture change right for this, it's not going to reap all the benefits that we want it to. So we have a really substantial comms programme linked to this, and it is part of our wider adult social care transformation programme, which has a really strong focus and a work stream around workforce culture and communications. So, and that I should say that that change is multi-agency and applies to our communities and the people who use services, as well as the workforce and proprietors of care organisations. So it is, think the more dialogue we have as a city about this, as people here have suggested, I think the better, because that helps to bring everybody on the journey constructively and in a kind of dialogue with us.
This wasn't my second question, but it suddenly came to me when you were speaking in terms of, with that change then, where are our biggest risks?
I think our biggest risk, and I think it was raised really helpfully earlier on, is around the financial risks. You know, and I think I have to own that one and name that one, because with any programme like this, when you've got such a demand upon a service, and that's what we have to mitigate as part of that and be really clear about that as we go forward. And to not say that, I think, would not be having the integrity within a programme. But I do think, you know, what Joe's talked about for me is what's been absolutely fundamental to everything that we do across adult social care is to have open conversations and to talk about it and find the solutions with partners, because that's the only way in which we can mitigate these type of risks that we've got. And the other key risk I think we have to own is that where people hear the anecdotes, you know, like Councillor Alston talked about earlier on, because that's what people then start to lose faith and confidence. And I think what's really important is that, again, we acknowledge that as a risk and we recognise that we have to talk about that and own that and work it through and make sure that we are absolutely working to the integrity and the principles in which we started off in the programme. And that's what's really important.
Yeah. Chair, I promise this is the last one. Looking at the quality of life index on that whole start report, Sheffield was ranked really quite low on that. Now, there's lots of other reasons in terms of the whys and wherefores. Some of that is geographical, some of it is demographic, and we can't help some of that. But thinking about what we are implementing, those that were nearer the top, what were they doing? What are they doing different? What were they doing different? And are we matching that good practice?
It's a really good question, and I started out working in community development, and that question about how we support people to be well and to have good lives, you know, runs through really the social work commissioning and the social care commissioning that my team do now. I think it's a really good question and a good challenge is, you know, what are we learning from those areas where they score much more highly? I think some of the things that we've learned as part of regional networks, all looking at this challenge around home care, but also around other types of care that I've just mentioned. One of the key things is how empowered people feel, how much choice and control they feel they have, and how much they feel they are treated as a person, a whole person, and how much their families experience that and their carers as well. So I think that that's something that we can make a huge impact with this programme about, and with all the other aspects of the Adult Social Care Transformation Programme. And I think if we think about our part in a whole system, and the whole system thinks about how we have empowered citizens and how we encourage people to feel the agency that they have in their lives, then I think, you know, this is a small part of that, but it's a significant part. We employ a lot of people in the city in the care profession and in the health profession as well. And when you start to build that all up, it is a significant impact that we can have. And many of these staff are people in lower paid work in many of the communities where we know that wellbeing outcomes are perhaps most challenged. And I really think that by looking at better outcomes for people who receive care, but also the workforce who support them, I think that will really have significant leverage in that really challenging space.
Thank you, Councillor Dunn, and then we'll finish with Councillor Diamond.
Sorry, Chair, I thought we finished at 5. I was going to withdraw so we could summarise.
No.
So I'll withdraw because it's quite a lengthy question. I'll send it in an email.
Councillor Diamond, do you want to come back?
Firstly, I'd just like to welcome Martin's suggestion about this committee exploring the wellbeing economy and how that might work for Sheffield. And I think that would really make a difference if we did move to that sort of model on the quality of life of people that we've just been speaking about. Going back to the new model that we're talking about. So currently people working, we know that they in home care, they're often lone working, they've got no agency, they're rushing between different jobs. I just wanted a bit more information about how you envision the new model working. So would the staff members, obviously they'll be doing more sort of team working, would there be a physical hub where they can be in a small geographical area where then they could go out from and then collaborate, talk to each other about what support that person or each individual person they're working with and families they're working with, what they might need. And I think if that sort of approach is what you're taking, then that will really empower and help with retention, working, and also could help with progression, because you could have people working at those hubs who are sort of more in a coordinator role, more receiving communication from families or even people receiving care, and then can sort of coordinate around that. So is that the sort of thing you're envisioning?
Yes, it absolutely is. And I think one of the challenges for commissioners is not to over-specify. And so, these are some of the things we want to try out. That's one of the reasons we're trying have a test site in extra care, is because there's a ready-made hub and very discrete geographic location there. So some of those principles are built into the tests that we are doing, the controlled implementation similarly, and I think it will vary from one area to another. So in some areas you may have a housing provider, it might be ourselves, it might be the council housing, it might be another provider. In some areas there may be a really there may be a health centre that's a kind of a hub in the community, or a library. But that's what we want to look at, really, is not sort of creating something new, but really building on existing social capital, if you like, and using locations that are already important to people and recognised wherever we can. I also think that it's important just to mention that collaboration can be supported by technology as well, just going to your earlier point. So we know that many of our care providers have adopted technology which enables them to have sort of real-time conversations with families and sometimes with the people they're caring for, which enables them, unfortunately for them, to be able to answer questions at any time of day or night. But actually, it's really exciting, and it's built much better relationships for them and enabled them to start, supporting their staff better and providing a better service. So there's a real, there are possibilities that wouldn't replace people coming together physically and being part of a multidisciplinary team, but there are also, as I'm sure you could probably advise me better, collaboration platforms and ways of multidisciplinary team communication, which I think will also really, really help, and for supporting dialogue with the people that are supported and their families as well.
Thank you for your answer. Is that okay? Basically, I've allowed this to run as it has because I think it's terribly important that we learn as much as we possibly can from it. And I think, thank you for your patience in listening to all the questions. And I just didn't feel that we needed to stop this dialogue going because it's a terribly important area of work for yourselves and for us as members providing a service. So with that in mind, the final question is with Councillor Alston, and then I'll try to summarise.
So it wasn't really a question, it was just a very brief comment based on what you were just saying. As somebody who used to be a community healthcare worker a while ago, I don't think you can overvalue, whatever the word is, the ability when you're working on your own, going round from place to place, to be able to come together as a group and offload the difficult ones, talk about strategies. It's just incredibly important for your ability to do your job, and if we can do that, I think that would make a huge, huge difference.
Thank you. Sorry, it was in my diary till 5 till for some reason, so I will ask my question,
Fine,
if you don't
fine.
mind then, since we have
Carry on.
time. I just didn't want to keep the officers here any longer. Absolutely welcome this. It's really, really great, and I want to congratulate you, and of course I know that George is really passionate about Foundation Living Wage and about making care a pathway for life as a career, because it's something that we've been really, really keen on. I'd like to know how with the JCC, the Joint Commissioning Committee, how is this going to really help support this amazing work? Because to me, the more that can be done through that, the more we can deliver that really local delivery, which Martin and Mary picked up on about, that really does make the difference. And I understand we have a new Integrated Care Board chair. And yeah, whether it's been announced officially, I don't know. I think whether George has received it. And really, how is this going to work? So we, on the grassroots, on the ground, are going to be able to do what makes that massive difference. Because all the policies in the world and all the board meetings in the world, we're all ticking a box, but it's what happens when you go into somebody's home and I have people in my constituency, if, they're due at 5, if it's 5 past 5, they're getting panicky because this is their life and it everything revolves round time, doesn't it? It's like my granddad, if they weren't there, he'd be ringing me up, God bless him. Oh, they've not been, and it'd be like, it's only 3 minutes past, Grandad, and then he'd be getting more and more, and it's so the less pressure that we have on these amazing people that deliver this, and the more diverse the people that go into this, because it is seen as a progression. Or maybe when you've been up there, you think, you know what, I'd love to do this for 3 days, because it's what I really loved. So I think we often look about bringing people up, but what about people that have been up there, or maybe want to transfer across? So I think it's a really important point that we don't look at everything just from one angle. So my 2 questions are in there, and then there's a bit of a comment, but I think it's absolutely brilliant. And I'd like to congratulate you. It's a really good piece of work, and I know it's been built on for years, and well done, George, for getting it this far.
I think, first of all, thank you very much, Councillor Dunn. Really appreciate that. And I think, I say a big thank you to Joe, who's done a huge amount of work, I think, to take this forward, and has a real passion for taking this forward, and that really comes across. And I think really good question you asked about the Joint Commissioning Committee, and one of the things that I think would be really helpful is if we have, I'm going to propose that this perhaps as an agenda item within the Joint Commissioning Committee to think about, because it's building upon your question earlier on, and to explore further. One of the key things that's been really helpful around this programme, though, it has been absolutely a joint endeavour with colleagues across health and with colleagues across providers and people who use our services. So really, taking that spirit of collaboration across all places. And then secondly, in terms of the integrity of the programme, that's what we absolutely want to take and going forward, and make sure that people's views and voices are central to this, because that ground is absolutely the key thing for going ahead. And for me, what's been really important in coming in is to make sure that we don't lose that. It's easy to get caught up in all the, as you say, all the bureaucracy, but actually what's really important is that we focus and empower people to go ahead and take this forward in a really empowering and supportive way. Yeah.
Thank you. I thought it was going to be the final question, but got...
Add very quickly to that answer, just very quickly. I think it's a really, really good point about how we work with the NHS around home care. It's not the first thing we always think about when working with the NHS, because we think so much around discharge and things like that. But one thing I would say is that the NHS also commission home care. Joe said privately a few things about some of the, the struggles that it has in working with them on that. Some great people working in the NHS, but I think that we are the best commissioners of home care in Sheffield. I think I'd like to say that. And so I want to work closer with NHS colleagues to look at how we can work together to make sure that all the home care that gets delivered by the public sector in Sheffield, we're working as closely together on that. And also, when we think about not just the way we commission that home care, but the aspirations that we have a council for the way that, some of the things talked about the way it's delivered. I want the NHS to have those aspirations too. And the last thing I would say on that is not just about the council and NHS, sorry, slightly moving a question. It's also all that home care that's delivered, privately out there, what I would sometimes call the Wild West. We don't necessarily know about it all, and how do we influence that? And actually make sure that those people are getting that same quality, and those care workers are we're aspiring for them the same paying conditions. So actually, the work with the NHS is absolutely about uniting and sharing those challenges, I think. Thank you.
Very quickly, Jo.
Sorry, very quickly. But I think it's really important to remember that we already joint commission some home care with health colleagues. So Care at Night service is an existing joint, collaborative contract which we put in place. I think it's been going. It must be coming up to the 3-year mark now. And that's been a really fascinating process. It's not the biggest service in comparison to the home care delivered during the day, but actually it has been a real test site for us in terms of integrating systems, sharing information, allowing access to one another's systems, working in an outcomes-based way, monitoring a contract based on outcomes instead of outputs, and overcoming lots of those cultural differences between the way the local authority might work and the way that the NHS has traditionally worked. So it's been a fascinating process, and I think we've learned a huge amount through that, which gives me the confidence that actually, we can drive this programme with that ongoing joint approach and provide an integrated service for people in Sheffield.
Thank you for that. When we started off on this meeting, I thought it wasn't going to last particularly long, but I think people have been fairly well engaged with this and see how important it is that we get this right, because people don't really want care if they can help themselves, but we've got to do it with dignity and respect as we move forward. I'm going to try to summarise some of it, and then we can have some actions from that. Clearly, this is not scrutiny. What we're trying to do is build on this and create policy as we move into the future. So this is positive action in a way, rather than just talking about what's gone wrong in the past or what's not been right. A tremendous amount of work has actually been done in this area. We see it every day on the television on a daily basis that this problem exists across the country, and we're not particularly alone on this. We're part of the issue that is developing. People need more care, people are living longer. These sort of things have always been something that we've been aware of. But one of the things that I wanted to raise, and I know I haven't left myself much time here, but one of the things that I wanted to raise was Sheffield was right at the beginning of this, if you remember, Jo. We were the very first city in the country, or second after Warrington, that actually developed extra care villages. And Alexis and I had a chat about this, and we are going to talk about this outside this meeting. And the reason I suggest that is because people are not needing care at that time. They're needing a sliding scale of care. And what they're doing is, and this is picking up on what Councillor Linda Zaman said about the communities that we live in and housing issues that may result as a result of it. Sorry to use the two results there, but it was people moving out of semi-detached houses in cul-de-sacs and moving into extra care villages where we had a mix of tenures, including rental purchase and part purchase. And we've got a fantastic example in Sheffield of Brunswick Village at Woodhouse, where when we first went out for consultation, we thought nobody was going to turn up. And at Ponce Forge, we had 2,500 people queuing outside, wanting to be part of that. And the wider picture on that was that it released family housing as well, which is sometimes only occupied by a single person. So when we're looking at this area of the service that we provide as a local authority, it is the wider thing that we also need to look at And the other thing I just wanted to briefly mention, I think we'll expand on it once we have our discussion, Alexis, is around the planning situation. And planning needs to be part of how we provide care as we move into the future. I'm talking in particular about extra care, because extra care falls into a completely different category. And we as a local authority could potentially promote land for use as for extra care, which isn't taking away from residential land. And that's the important difference. And I do know there are people out there who would like to engage with the local authority to do that in almost certainty. I mean, when you read the report, I thank you for the report, because the report has been no punches pulled. It's been only honest and straightforward, and that's what we need to hear, because that's the only way we can then build upon making decisions as we move forward. But the key areas that I think that everybody's alluded to is cultural awareness, because I think that's an increasing number of people will be needing care from different minorities and different cultures. And we did start to look at that 20-odd years ago as well. And if I just mention it very briefly, at the time we were looking at potential extra care villages in Abbeydale, Walkley, Page Hall, and Brunswick, which actually happened. So that work is still there, and it's something we as a local authority were well ahead of, and we can pick up on that. And I know there's a cultural difficulty for some people to even want to access care, because I remember conversations with families at the time where they clearly needed care, but they were reluctant to ask us for it because it was seen as a dishonourable thing to do. I think we've moved away from that culture now with people not wanting to. So that's one thing. The other important thing that we've raised as a group today is the connection with the LACs. That is, in my opinion, terribly important, and something we need to build on in the report that we present to the Co-op exec, because the LACs are going to be people who are connecting with the community, are part of the community, and can probably give us opinions and guidance that will be quite helpful to us. Finance is a big issue, and on that, basically all I will say is, where do we choose to spend our money? I know we're not going to, may not get the amounts that we need from central government, but I've been around local government for nearly 35, 40 years in one way or another. I have never, ever known a year where somebody said, you've got lots of money. It's always been, we're short of money, we've not got it, and we've got a crisis coming. And I can honestly, hand on heart, say that that's been my experience in the last 40-odd years. So that is always going to be a big issue. We're never going to have enough. But we as a local authority do have options. And the options that we do have is what we spend our money on. And if we choose to spend it on, I'm not using this as any sort of political angle or whatever, we may spend it on the city centre, regeneration activities, we may spend it on other issues that are important to us. But I think the key importance to us is the public out there are wanting services from us when they're at most at need. And that is the area that we should be promoting for expenditure on. And if that means that we have to divert the money from elsewhere, that's something that we can highlight in the reports that we do. The other one is obviously around wages and retention. I think a number of councillors mentioned that. I remember from many years ago where some new operator came into the city. This has been happening for 20-odd years anyway, the difficulty in recruiting people into the care sector. And we said, what's your business model? Because that was a commissioning exercise. And the answer was, we are struggling here for care workers. What are you going to do? We said, we'll pay them £6 more than everybody else, and we'll bring them to our facility. So we've got to look at that. And I think a point that Councillor Dunn raised, which I completely agree with, it's not always people who are at the start of their careers who want to do this sort of work. I have known of people who were bank directors who chose to leave their job and get into care because they felt it more rewarding. So it's not just a certain sector that we're actually aiming at, it's probably widening that. And as an authority, maybe we can somehow encourage that in the round to happen. Talked about area stuff. Technology is another area. I know you've touched on it, and it's going to become an important part of it. But many years ago, again, going back on my days when we were trying to do a bit of commissioning, We had a gentleman who came from America who wanted to invest in this city, and he came up with ideas like he did a presentation. He said, well, what we can do is we can have sensors around the room. We'll know what a normal person's pattern of life is, and if for any reason that person doesn't have that normal pattern of life, we certainly know that there is an issue developing, and it will be a call center somewhere that will see it immediately and dispatch somebody. Somebody doesn't go to their medicine cabinet when they should have done. That would trigger that off. And I thought it was pie in the sky because I'm IT illiterate completely, so I don't understand all that sort of stuff. But now I'm realizing that these things can happen. So technology is going to be another way forward on this. So I hope I've encompassed everything here, but what we are going to do is we're going to bring it together with what Emily's going to do, and then we'll share that report with everybody in the committee, and then the intention is in the January meeting or March meeting, I can't remember which one we said.
Anything that the Transitional Committee wants to kind of approve, we'll bring to the at least the March committee for you to kind of come to a view on your kind of policy advice to the executive. We'll try and pull together. It may be that we try and arrange some further conversations with you about home care with different stakeholders, and if you can leave that with me to work with Alexis and Joe to maybe arrange some of that. And then based on all of those conversations, we'll pull together what we've heard from the committee discussions and pull that into some kind of coherence document for you to comment on before the end of this year. If that's okay.
Thank you, Emily. And finally, I completely forgot, is the link between care and home care. I think that's quite strong. I know we're not talking about care homes here, but they do have a role to provide, and if we don't actually look at them in the whole, then we're going to be missing something, and there's going to be criticism that we didn't actually talk to the care home sector, which I know is a very vociferous sector and has been challenging the local authority for quite a number of years now and continues to do so. And I know there's been the Cordis Bright report, which has been done recently, which the Sheffield Care Association don't quite agree with the findings of. So what I've agreed with Alexis and other members are happy to join me on that. We will go and talk to them and invite them to have a chat. Emily's going to set that up. And it's just to say, look, you know, we are listening, we are moving forward to trying to formulate a new policy for the new committees as they appear in next year. So that's the intention. In terms of the work plan, Emily's going to outline that work plan. I think as a committee we're doing quite well in terms of the areas that we've been given. They are sometimes the key areas, the most sensitive areas, and therefore the differences between us are fairly limited in trying to take this work forward, which is a privilege for me because it's made it a lot easier for me, to be honest. Thank you, and if Emily can...
The main things I wanted to pick up under the work plan, really, we picked up under the minutes about the January meeting and having an opportunity to hear from young people on the SEND transitions. And I think if we go away following this meeting and the issues that you've raised here and think about how we can best kind of bring you some more perspective and views perhaps on some of the issues that you've raised today to help inform any recommendations you want to make on home care, we'll work on that between now and the new year if everyone's happy with that.
Any comments from members as the way forward? Or shall I call it a day? I think silence means that's the end of the meeting. Thank you so much for your patience. Sorry.
I think we need to have a report back at the appropriate time at how things are progressing.
Yeah.
In particular, the involvement of SHAR, I'd be keen to understand what they're doing and how they're being involved and what their findings are at the right time.
Thank you. Thank you.
Thank you. Yeah, I'm just keen to know, we've listened to the report and we've asked lots of questions, but I'd like to know what happens with it, because we're policy forming, we're not just sat here in front of the public, so I'm a bit confused about that. So I'd really like some concrete about, so we can prove what this committee's done apart from ask questions, because that's what scrutiny does. So it's kind of, I really want to know that, and I'd be really keen on seeing what moves forward. And I know it's all early days and everything, but it's really important for the public that they see the difference that this way of working is going to make. Yeah, thank you, Chair.
Thank you for that. I think in my summary I've outlined the fact that we have picked up on a number of issues, and I have commented on the fact that this is not scrutiny, we're trying to build policy from this. And as a result of the things that we've outlined here, Emily's going to go away and do the basics of what we've heard here today from the questions and the answers that we've got. And in order to move this forward in a more positive way is to bring out some of the things that we'd like to see happening, and then those reports will actually be sent out to all members before we sign them off for the Co-op exec. Councillor Oxley.
I understand what Councillor Dunn is saying, but you know, in terms of this report, it very much sits in a similar format to where we were in terms of the SEND report and where we are in terms of we're in the middle of a transformation programme, a change programme, and to a large extent that policy was set when that transformation change programme was initiated. So I take it what you're saying, but I think going forwards, without impacting too much on the milestones and what's already been set in terms of that work plan, it's going to be difficult for us to change policy halfway through a transformational change until you've actually got to that change, unless something else comes up that we really definitely need to take into consideration. So for me, it's more continual reports on progress and where we are that's important with this in particular, unless, as you outlined, that there's other things that we might want to incorporate into that, such as talking to care homes and seeing how that also fits into this plan.
Thank you for that, Councillor Oxley. I mean, it's entirely that's both of the areas that we've been seem to have looked at have already started their transformations, and a lot of the work, background work, has been done there, which is quite useful, really, because it gives us the opportunity now to add to that as we move forward into policy formulating with a view of, with a more clearer sort of head in terms of what can we add to what you've already done, so that we put it forward in front of the exec and say, this is where we believe that there should be an enhancement in terms of what's already been proposed, because what you're proposing at the present time is as the situation stands now. What we want to present is where the situation should be, in our opinion, for the decision then to be taken by the exec to say whether they are going to support that or not. So yes, there is a progression to this, and as I said, we're quite fortunate in the sense that both the areas that we've looked at, there has been quite a lot of work that's already been done on there. So as Councillor Oxley quite rightly says, it's the additional stuff that we can build upon that would be our sort of advice to the exec. Councillor Lee?
Yeah, Alexis said she was discussing the LACs and what contribution might be made there with Dawn Shaw. So I think that will be one of the things we'd like to explore about how we can, as LAC areas, contribute to this, and how we can, what we can do. You know, part of the role of the LACs is to hold services to account. And if we've got something in our community plan that relates to older people, then we would certainly want to look at what services are delivering that care, and how we can monitor the input they're having and how we can help them to deliver more, if you like.
No, I totally agree with that, because the LACs are going to be quite critical to on all of the various transitions anyway, and this one even more so. Councillor Dunn?
I completely agree and support, and I suppose it's quite different because we've been used to forming policy, and I thought this would be for the councillors to be doing some research and helping get the evidence. Obviously, the officers are the experts, but part of moving to a committee system next year is that we will have to ask for that. And it's what I have done on the SEND and what George has done on this. And this is the opportunity for councillors to do some research and push further on that. And that's where I'm getting at, Chair, because otherwise it is, you know, so I think it would be really good. I mean, I personally don't need to do any more on mine because I'm the one that's been leading and pushing on that area as George's, but I'd be interested in kind of knowing how our point of view, because we're cross-party, and how that does it, and that would really help when it gets to exec then. It's probably going to be a much more rounded view, because what the last thing we want is cumbersome decision making, and I think the more that we get used to working like this, and I think this is such a fantastic area, and it's got two of the most important ones for our communities. I think that would be a really good way, especially to show the public how we are all working and forming the policy, because we've done a really good discussion today, really well balanced, really respectful, as it is 99.999% of the time. And now I'd like to kind of push on to the areas that you think on that. So I just think it's a really good way forward. Thank you.
No, I don't. I think we're aligned on that. There's no real issues there. But the idea is that we move forward with genuine additions and enhancements to the policy that's already been starting to formulate, and to give the officers the confidence that that's what we are actually doing, and not just working with what we've had previously and what we've been dealing with previously. So this is the more sort of enlightened way of actually moving it forward. And that is the intention. Councillor Diamond, I think we're getting to 5:30 now as well.
Right, yeah, I'll be brief. Yeah, just think there has been quite a lot. It's been a really good discussion, and there's been quite a lot of positive engagement with the way that we're already moving and what the plan's trying to achieve. And sort of on the policy side of that, we've talked about, you know, empowerment for staff and empowerment for families, and working in smaller geographical areas, which is something that is already being taken forward. I think everyone's signalled support for that. More sort of team working, more progression, and then sort of mapping community assets, maybe on a LAC-wide level, and for that to be a resource for the people that work in this sector, but also like more widely as well. So I think they're the sort of policy things that we could look at taking forward.
Yeah, thank you for that. I think I was just having a conversation with Emily around the LAC situation and how we can build upon that. I think that is quite an important aspect of it, and I've not forgotten the well-being company side of things as well. So these are all sorts of things that we're going to explore. We're going to have discussions with people. Members are more than welcome to join them. Emily will send out times and dates and when we're meeting different people, and that is where the enhancement will start to come. So I'd just like to say thank you for your wonderful presentation today, and thank you for all the members for all their contribution, because as I said, this has been quite a good dialogue between people on a cross-party basis, and hopefully it's because the two areas that we're talking about are so sensitive and so important to the public and for us as well as service providers. So thank you so much, and we will keep moving forward. What I will say is, if any member does have any further contributions to make, then please share it with all of us, and we will try to accommodate as much as we can, because there is not a monopoly on ideas. It's all of us coming together to make things better. And as I said earlier, and I keep reiterating, these two areas are terribly important. This is what we're judged on by people, the humanity of the authority. And that's what we've got to be aiming for, that we do get that right. So thank you so much, and I'm sorry we've taken over. We've gone over time by about 4 minutes, so my apologies, but next time I might do better. Thank you. Bye.